Hi, I'm Dr. Edward Smuck, OBGYN, and welcome you to my video blog. Today I would like to talk about pain management in labor. Now, I get a lot of questions on what are the options, so I'd like to go through that today in my blog here. Basically, we have three options for you. One is no drugs. Number two, IV drugs. And number three, epidurals. So I'd like to go through each one of those areas briefly to introduce you to that aspect of labor. Now, realize this is your labor. You have to make these decisions. We'll help you along with the nursing staff to educate you as you go through labor about what are your options and what is best for that time in labor. However, you want to go in with a prepared outlook on what you want. First option, number one, is no drugs. And many women decide and tell me and during the pregnancy that they would like to go without any medicines, and that's perfectly fine. This is your labor, your delivery. You have to help make those decisions and take control of your labor if you can. So, the good part of no medicines is that there's nothing going into your body and nothing going into your baby's body. Many women do prepared childbirth classes and learn how to manage pain without medicines, and an old typical way would be the Lamaze method. There's other methods, and this is your call. The good parts of that, again, are no medicines are going into your baby or into yourself in labor. The drawbacks that I see is labor hurts, and women typically will request some type of medication to help them out. So we're going to go into number two, and that's IV medicine. These are narcotic type drugs that we can give you through your IV that help take what I would say the edge off things. Labor hurts. The IV medicines will not take your pain away completely. It actually works more in your brain and make you a little bit lightheaded or not able to focus very well, and inhibits your ability to think properly for a little bit of the time that the medicine is working. However, it is a good medicine for many women as they are entering more of an active phase of labor and they need something to just get through it, especially if they've gone many hours already. That's the good part of IV medicine. The drawbacks, as I see it, is that we don't want to give it to you just prior to delivery. It goes to the baby and has the potential to decrease the baby's ability to breathe at delivery. And that's a given within the hour or so prior to delivery. So as we're getting closer to delivery, we frown upon the IV medicines. Number three, that's very, very popular these days, is the epidural. Now this became popular and used extensively back in the 1980s. So since then we've had almost 30 years of great data on epidurals in labor. And it's a fantastic way to go if that's what you want to do. Now at Banner Desert Hospital we have anesthesiologists who administer the epidural. They will do this at the appropriate time. Now, I get a lot of questions on when could I have my epidural? When I walk in the hospital, can I have it? And there's a couple of different things we have to look at. Traditionally, it was taught that we shouldn't give epidurals before 4 centimeters. We had to make sure the women are in labor and it's not going to slow it down. That has been somewhat refuted through the years, especially in the last decade, where we see that women can do very well with earlier epidurals. However, sometimes we will need to augment their labor if that epidural will slow it down. in the early part of the labor. We can manage this very well. Now, another question I get often is, will that lead to increased chances of having a C-section? And you can look at a lot of data out there, and it goes both ways. I believe in the hands of people who know how to give the epidurals, which our hospital anesthesiologists do very well, and in the hands of the doctors managing it and the nurses managing this, that we get great outcomes and there's no increased chance of a C-section just because you have an epidural. Now, those are some of the highlights of the epidural. I would also say that I get questions on, I don't want a needle and I don't want something being poked in my back and staying in there. Well, yes, you will have a small needle placed to numb up your back, and then you'll have a little bit longer needle to place the catheter. The catheter is a rubbery, not a needle, but a rubbery catheter that is very easily bendable. So once that is placed, you can lie on it and turn side to side. It's not going to come out. It does not hurt once it's in. That epidural is placed on a pump. The pump gives you tiny bits of the medicine as you go through the whole labor process. So literally, that epidural can stay in your back for 1 to 2 days, no matter how long your labor is. Now, hopefully, you're not having a 2-day labor. The drawbacks with an epidural, as we see, are number one, it can lead to headaches after the administration, and that's unusual. Once in a rare time, once it's given, it can drop the baby's heartbeat. We do measures prior to the installation of the epidural to prevent that. There's some other higher risk but very, very rare complications with this, and that's one thing you want to address with the anesthesiologist or me or the nurses personally at that time. Is it harder to push a baby out with an epidural? And what the epidural does is numb the sensory nerves from basically your waist down, and will numb some of the motor nerves from the waist down. Now, it doesn't do that completely, so you're not completely numb. You'll be able to usually move your legs and have some sensation of pelvic pressure, so you can push at the appropriate time. In conclusion, I hope that this has given you a little bit of knowledge about what your options are in labor, and as always, you can ask me questions at visits anytime you want. I appreciate your time today, and thanks for watching my blog.